Hello everyone, this is Dr. David from drregisternurse.com. Today we're going to discuss seizures. So we're going to go over generalized versus focal, and we're also going to discuss the different types of nursing interventions that you as a nurse or nursing student should be doing when caring for these patients. Make sure to watch. So let's talk about seizures. As you know, your brain controls your entire body. Well, how about if what's happening is inside your brain? Well, guess what? A seizure is a sudden uncontrolled electrical disturbance in the brain that is being caused by the abnormal electrical signals that are being sent out by neurons. They are constantly firing and firing in the brain, and these neurons are the excitatory and inhibitory neurons, but we're going to talk about those in a few minutes. First, let's go over the two types of seizures that a person can have, which include generalized and focal. The generalized seizures can affect the entire brain. This one was previously known as grand mal seizures. The focal seizures, also known as partial seizures, can have an effect in part of the brain. So what are neurons? Neurons are responsible for the handling and transmission of information. The two neurons we're going to talk about are excitatory and inhibitory. Excitatory first. What does the name say? Excite. It stimulates a response. It excites things. But in order for this to happen, it has to release the neurotransmitter glutamate. Now, we also have inhibitory, which is the opposite of excitatory. Inhibit means that it's going to decrease a response. So when this neuron is stimulated, our response is going to decrease, but in order for it to do so, the neurotransmitter GABA has to be released. Now, why is this important to know? Why am I talking about GABA and glutamate? So scientific, right? And this picture I'm showing you doesn't even help. It's making things a little bit even more complicated. Forget it. It's not complicated at all. Remember, excitatory neurons release the neurotransmitter glutamate, which is responsible for the excitement of things. And the inhibitory neurons are responsible for decreasing a response by releasing the neurotransmitter GABA. So what would happen if a patient comes in and they had a motor vehicle accident, which as a result has a head injury, and it causes damage to the inhibitory neuron? Well, now we cannot release GABA, which is responsible for decreasing our response. So which one you think is going to accumulate in the brain? Glutamate. It's going to overstimulate your brain, causing abnormal electrical activity, which will lead to seizures. So we have to treat the patient in a way that's going to create a balance between GABA and glutamate. And this is where anti-seizure medications such as barbiturates come in. They target the inhibitory neurons and stimulate it in order for it to release GABA. That's going to decrease that overstimulation that has been caused by the excitatory neurons releasing too much glutamate. Now let's talk about some causes of seizures. The number one thing that I want you to remember is that seizures do not discriminate against anyone. It can happen to children as well as to adults. Now, if it is related to an illness, it has several causes. For example, trauma. Did the patient have a motor vehicle accident that caused a head injury? That can cause a seizure. Also, did they have a very high fever? Usually, fever seizures are fevers that the fever is over 104 degrees, and this usually happens more to children and infants. Also, did they have a problem with taking their medications? Are they non-compliant with their medications? This pertains to those individuals that already have a seizure history, are supposed to take their anti-seizure medications in order for the therapeutic level to be reached, and they either haven't taken it, don't have access to it, and those therapeutic levels drop. So that will lead to seizure activity. Another cause, hypoxia. You know that we need oxygen. Everyone needs oxygen in order to survive, right? So low oxygen levels to the brain can cause seizure activity. Now the big one, electrolyte imbalances. So can you think of some electrolytes that if there was a problem, you would see seizure activity? Hypoglycemia. How do you feel when you're hungry? You feel weak, you feel tired. Can you even concentrate? I can't concentrate when I'm hungry. So you want to make sure that you're monitoring those blood sugar levels because they can lead to seizure activity. How about hyponatremia and hypernatremia? I want you to remember that whenever a patient has any sodium imbalance, it will affect their neural status. So when someone has hyponatremia, which is a sodium level under 135, it can cause many neurological effects, especially seizures. And guess what? If the sodium level drops under 120, and they usually say around like the 110 to 115 mark, they can even have permanent brain injury. Now, how about hypernatremia? Too much sodium. When that sodium level is above 145, you feel like you are dry, right? It's when you eat a lot of salt, and what do you need? You need some liquid, you need water. So that means that you are becoming dehydrated. So dehydration can have a severe effect in your brain. So this may lead to abnormal electrical activity, which can lead to a seizure. Now, how about hypocalcemia? Do you remember what happens when a patient has hypocalcemia, which means that their calcium level is under 8.5? Who can remember Shovstex and Trousseau's? Remember that when a patient has hypocalcemia and they have a tourniquet applied, for example, a blood pressure cuff, and I want you to look at this picture for a visual. What happens to that arm? It twitches up, right? Like an L, it goes up. So remember, tourniquet starts with a T, Trousseau starts with a T, T and T. So when a person has hypocalcemia, they will experience Trousseau's. And Shovstex. Shovstex is when you touch that patient's cheek, what happens? They have a twitch. And the way that you can remember that is that cheek starts with a CH and Shovstex starts with a CH. CH, CH. So those are forms of seizures. Okay, so it's very important that you're monitoring that calcium level and making sure that it's within normal range. How about brain cancer and tumor? This is one of the things that can definitely cause seizures in patients. When somebody has a brain tumor, guess what is the common symptom that will lead them to know that they have a tumor or brain cancer? A seizure, okay? Seizures are the presenting sign of a tumor in up to 50% of patients. So remember that. Another cause of seizures is a patient, an individual that's going through alcohol withdrawal. And alcohol withdrawal happens when you have been drinking a lot of alcohol for a certain amount of time and you suddenly stop and cut back. One of the most common types of seizures that you will see in a patient that's going through alcohol withdrawal is DTs, delirium tremens. When you have a seizure due to alcohol, you are more likely to develop DTs. And this is the worst stage of the alcohol withdrawal process. And guess what? It happens usually about 3 to 5 days after that person takes their last drink. And it can be super life-threatening, okay? Symptoms of DTs include sudden and severe mental or nervous system changes, uncontrollable tremors. Another cause for seizures is called epilepsy. Epilepsy is a chronic seizure condition that causes individuals to have frequent seizure activity. According to the Center for Disease Control and Prevention, about 3.4 million individuals in the United States have epilepsy, and that includes an approximate 3 million adults and 470,000 children. So what are some causes of epilepsy? It could be brain development, brain injury due to a trauma that caused head injury, infections such as meningitis, as well as a massive stroke, and how we have discussed, brain tumors can also lead a person to develop epilepsy. Prior to talking about the different types of seizures, let's first discuss the different stages that an individual experiences prior to, during, and after a seizure. These stages vary depending on the type of seizure that the patient is having. For example, some individuals have mentioned that prior to having a seizure, they may feel an aura, which is a feeling, experience, or movement that just seems different to them, and it serves as a warning to the individual that a seizure is going to happen. Other seizures may be short, some may take days to recover from. A seizure can be composed of 4 distinct phases that include the prodromal, aura, ictal, and post-ictal stage. About 20% of individuals that experience a seizure go through a prodromal phase. This is a subjective feeling or sensation that can occur several hours or even days before the actual seizure. Remember, this happens before the seizure. The most common symptoms of a prodromal phase include confusion, anxiety, irritability, headache, a tremor, and anger or other mood disturbances. The prodromal period may serve as a warning sign of a seizure onset for those who experience it, but unlike an aura that is part of a seizure, this phase is not part of the seizure because it happens before the seizure occurs. And an aura is actually the earliest sign of seizure activity. The aura phase is also described as the pre-ictal phase. This phase occurs within a few seconds to minutes prior to a bigger seizure. However, it does not happen with all types of seizures. This is most commonly with the focal seizures or tonic-clonic seizures, which are the generalized ones. An aura is basically a warning sign that a bigger seizure is about to happen. Remember that an aura is considered the earliest sign of seizure activity. So patients that have epilepsy or seizure disorder will usually know what type of aura, what type of symptom they would get prior to a bigger seizure. Patients that have reported an aura during a seizure have stated that they've experienced vision loss or blurring of their vision, hallucinations, sudden bitter taste in their mouth, as well as a subtle arm or leg twitching, and a lot of them report the inability to speak. So as the nurse or nursing student taking care of this patient, you want to make sure that you ask them this information in order for you to prepare in case you were to spot any of these signs and symptoms. So you want to ask them, do they feel that an aura happens prior to having a seizure? If so, ask them what is the typical aura for them and what do they experience in order for you as the person caring for them to be prepared. Now we enter the ictal phase. The ictal phase usually lasts about couple seconds to a few minutes, usually about 1 or 3 minutes. And the ictal phase of a seizure usually resolves on its own. However, and sometimes it does not. So why is timing so important? Why am I telling you right now that you need to time the seizure? Well, as a nurse, you need to time the seizure because if the seizure lasts longer than 5 minutes or the patient does not stop having seizures and you see them have 2 or more consecutively, the patient has entered into a condition that is called status epilepticus. Now, why is status epilepticus dangerous? Because at this point, it is very, very unlikely that the seizure will stop on its own, as it will need emergent medications to actually stop the seizure from continuing. Status epilepticus is an increasingly recognized public health problem in the United States. It is associated with a high mortality rate that is largely contingent on the duration of the condition before initial treatment. As a nurse or nursing student, it is very important that you stabilize the patient. You're looking at those ABCs, airway, breathing, and circulation, as well as the patient's neural status. Make sure that you are timing the seizure and assess the patient's oxygenation. If the patient needs oxygen, please provide it. The medication of choice that you will see administered to the patient are benzodiazepines that include diazepam, lorazepam, and midazolam. Benzodiazepines enhance the effect of the neurotransmitter GABA, resulting in a sedative state for the patient, as well as induces sleep, works as an anti-anxiety medication, an anticonvulsant, and a muscle relaxer. Remember that GABA is the neurotransmitter that is released by the inhibitory neurons. So by benzos enhancing the effect of the neurotransmitter GABA, it allows the brain to come into a more of a balance between the glutamate that is released by the excitatory neurons, which increase and excite everything, it's what's causing the seizure, and the inhibitory neurons that are releasing the neurotransmitter GABA, which are meant to decrease this abnormal electrical activity that's happening in the brain. The post-ictal phase refers to the period of time immediately following a seizure. This phase can last for seconds, minutes, hours, and sometimes even days. It is commonly thought of as the time during which the brain and body recovers from the seizure. During this phase, the patient will be super tired, confused, exhibit memory loss, and may have sustained injuries from the seizure that includes injury to their tongue as a result of biting their tongue during the seizure, and body injury due to the body movements and tremors during the seizure episode. It is super important to allow the patient to sleep, so as their nurse, you need to let the patient sleep peacefully without any distractions. Now let's talk about the different types of seizures. Remember that in the beginning we said that there are two categories of seizures, which include generalized and focal seizures. Here we have an amazing drawing provided to me by Mike Draws Patho, who turns difficult to understand material into easily understood cartoons. I will make sure to leave the links to his pages in this video's description. The most common seizure that you've heard of is probably the grand mal seizure, which is the tonic-clonic type. These patients usually have an aura. Remember, an aura is basically a warning sign that a bigger seizure is going to happen, but an aura is the earliest sign of a seizure. As a nurse, you need to position the patient side-lying and place a pillow or cushion under the patient's head, as this position allows the patient's saliva or any other fluid such as vomit to drain from the mouth, and this reduces the risk of choking. Also, this position prevents the tongue from blocking the patient's airway during the seizure. During the seizure, the patient may have loss of consciousness and will have tonic effects. This means that the body's stiffening occurs. The patient may also groan due to the body's rigidity. They may bite their tongue as well as the inside of their cheeks, which can cause blood to drain out of the mouth, which is why positioning is super important. So make sure as the nurse that you are placing the patient in a sideline position. Also, during a seizure, patients are not breathing efficiently, so this may lead to cyanosis, where the patient's color becomes bluish due to not breathing. You may also see the patient foaming at the mouth. This happens because during a seizure, the mouth is forced closed, which stimulates the salivary glands and makes the patient produce extra saliva. When the mouth opens again, the frothy saliva will drain from the mouth. It is very important that you do not try to stop the patient's movements or hold them down during the seizure episode, as this can cause further harm to the patient. After a few seconds or minutes of the tonic phase, the patient will have clonic effects, which include reoccurring jerking movements that go from jerking movements to relaxations and all over again. These uncontrolled movements can cause the patient to lose control of their bowel movements as well as urinate on themselves. Remember, the seizure lasts 1 to 3 minutes. As a nurse, you need to time the seizure and document. If the seizure lasts more than 5 minutes, the patient is entering into the status epilepticus stage, which is a medical emergency, in which the seizure cannot stop on its own and needs medications such as benzodiazepines to stop. As a nurse, you need to initiate the emergency response system or rapid response system that is available at your facility so that you can help to stop this seizure as a team. Patients with tonic-clonic seizures are at high risk for status epilepticus. Remember that after the seizure, the patient goes into the post-ictal stage where they are super tired and they won't remember what happened, and they can be also very confused. It is very important that as their nurse, you allow the patient to rest and sleep without distractions. Some patients may sleep for hours to days after a grand mal seizure. As a side note, there are patients that have specific generalized seizures. For example, some can have just a tonic seizure type where they have the body stiffness and rigidity, or they can have the clonic seizure type where they have the reoccurring jerking, and it could be symmetrical or asymmetrical. And when they have the tonic type separate or the clonic type separate, the patient remains conscious, which is a difference when they have both together tonic-clonic during a grand mal seizure. Another type of generalized seizures are called absence seizures. They are also known as petit mal. They are more common in children, and they begin and end abruptly, so they only last a few seconds. absent seizures can be so brief that they sometimes are mistaken for daydreaming and may not be detected for months because they are so fast. Remember, absent seizures causes a short period of blanking out or staring into space. They usually affect only a person's awareness of what is going on at that time, and they immediately recover, and they don't even remember what just happened. Because of how brief absent seizures are, they are often missed. Remember that tonic seizures causes the body to become stiff and rigid. Well, adding the A to the word tonic means without. Atonic seizures are a type of seizure that causes sudden loss of muscle tone and strength. These seizures are also called drop attacks or drop seizures. The sudden lack of muscle strength or tone can cause the person to fall to the ground. The person usually remains conscious and may not always fall. So if the patient is at risk for falling due to losing muscle tone, they can injure what part of the body? Their head. As a nurse, you need to make sure that the patient's head is protected from injury. You should incorporate a helmet into the patient's plan of care as they can randomly fall at any time. Very important, the patient remains conscious and the recovery is super quick. Now let's talk about focal seizures. Seizures are also described depending on a person's level of awareness during their seizure, which means whether or not they're aware of the seizure and what is happening around them. These seizures are known as focal aware seizures, and they were previously known as simple partial or focal impaired awareness seizures, also known as focal complex. In focal aware seizures, or your simple type, the person is conscious, they're aware and alert, will usually know that something is happening and will remember the seizure afterwards. The symptoms, though, vary depending on the location that is affected in the brain. So this seizure is location dependent. For example, if the seizure originates from the frontal lobe, your patient may be unable to communicate with you. Or if the seizure originated in the occipital lobe, your patient may present with vision changes. And these auras last less than 2 minutes. And remember, the patient is conscious. They are aware of what is going on. Focal impaired awareness seizures, previously called complex partial seizures, affect a bigger part of the brain than the focal aware ones and usually originate in the frontal lobe. And remember what the frontal lobe is responsible for. The frontal lobe is responsible for communication, for feelings, for emotions. The patient is also unaware of what is happening and exhibits motor symptoms, which is totally different than the focal simple type, in which they are aware of what is happening. These motor symptoms are called automatisms. So what are automatisms? They are non-purposeful and repetitive behaviors that are usually inappropriate for the situation. And the big thing is that the patient does not remember doing these behaviors during the seizure. Some of the behaviors may include lip smacking or chewing movements, repeatedly picking up objects and pulling at clothes. Suddenly, they may lose muscle tone. Remember, we talked about Atonic. So you want to make sure that your patient is safe because the biggest part of their body that can get hurt is their head. So we want to incorporate a helmet to the plan of care. It can also include repetitive jerking movements that affect one or both sides of the body, as well as making a loud cry or scream. And as a side note, patients that have a focal impaired awareness seizure will usually have a focal simple, or the new name focal aware seizure first, because it is considered an aura. It is super important to assess a seizure history on your patient. If you already know that they've had a seizure in the past, you want to ask them, what type of seizure did they have? How long has it been since their last seizure? This will give you such an important piece of the puzzle because you are able to prepare ahead of time. You want to know, how long does these seizures last for your patient? Do they have an aura? Do they have those signs and symptoms that will tell them a bigger seizure is about to come? And how long does the aura last prior to getting a bigger seizure? These are all super important questions that would allow you to care for your patient better in order to prevent a negative patient outcome. Very important. When was the last dose of their anti-seizure medication? Because when they come in, you're going to do a medication history. So you want to make sure that you note down when was their last dose, because you will be given the medication. Your patients that have seizures are taking anti-seizure medications. So taking medications involves getting the right balance of the dose, seizure control, and side effects. So one of the things that can cause a seizure is when the patient is not taking enough of the medication, and they are under the therapeutic drug level that we want the patient to be in order for the medication to actually work. Therefore, it is very important that you as a nurse are monitoring these therapeutic drug levels of your patients, because if your patient is under-medicated, they can have a seizure. As a nurse, you want to always look at your patient load and ask yourself if there are any patients that may be at risk of having seizures. For example, do any of your patients have a seizure history, a head injury, or even going through alcohol withdrawal that can lead to seizure-like activity? Remember that you don't have to work in a neuro floor to care for patients with some type of neurological history. You can care for patients with neurological disorders in any unit. So if there are any patients that are at high risk of seizures, make sure that you place them on seizure precautions. These precautions include having an IV access. Your patient must have an IV access in order to receive IV medications that's given in the event that a seizure occurs. It is also super important to have an oral airway, oxygen, and suction readily available, and keeping the head of the bed in the lowest position possible with the side rails up and with padding in order to prevent any type of bodily injury that occurs during a seizure. Your patient should also have a pillow or cushion on the bed in order to protect their head during a seizure, and wear loose clothing, non-restrictive clothing, so that they can be comfortable and be able to move during those seizure activities that cause tonic and clonic movements. So what is our role as a nurse when our patient is having a seizure? Number one, place the patient on their side in order for anything that's in their mouth, like saliva or even vomit or blood, can drain out of the mouth. Do not restrain the patient during a seizure. You can cause more harm to the patient as well as yourself. Do not insert anything into the patient's mouth, and make sure to remove anything that can harm the patient, such as eyeglasses. And remember to time the seizure. It is super important. If the seizure is greater than 5 minutes, what can this lead to? Status epilepticus, which will need emergent medications in order to stop the seizure. So you need to activate the rapid response or emergency response team. Note and document the characteristics of the seizure before, during, and after. For example, did they have an aura right before they have a bigger seizure? Did they become stiff? Were they jerking? Was there any blood coming out of their mouth due to the patient biting their tongue or their inside of their cheeks? Did the patient become incontinent? All of this information will help the doctor determine what type of seizure the patient had based on your observation. But how about if you did not witness the seizure? Well, ask these questions to whoever was with the patient at that time. It could be a family member, a nursing assistant. But it is very important to get some of this information because it will help determine what type of seizure the patient had. Remember to always stay calm and reassure the patient and their family, because this is a very nerve-wracking time, especially when the patient has never experienced a seizure before and when the family has never witnessed a seizure before. Once the seizure is over, as the nurse, you want to make sure that your patient is stable. So you want to make sure you get a set of vital signs, perform a neuro assessment, check their mouth to see if they bit their tongue, because if this happens, their tongue can become very swollen and the patient's airway can be compromised. Assess your patient's behavior. Check on any new medication orders that were ordered for your patient, as well as any lab draws that need to be completed. The doctor may also order an EEG for your patient. This is a test that checks the brain's electrical activity. It is a painless test. The only thing that the patient should not have any caffeine prior to the test. Their hair has to be washed and dry because during this test they put some electrodes on the head. Also, the seizure medications that the patient has to have need to be held. Why do you think the medications should be held? Well, although we do not want the patient to have a seizure, the best time to have a seizure is during the EEG exam because it will provide information as to where the seizure is coming from. So we need to provide our patients with education that will give them information about those things that can trigger a seizure. Let's use the mnemonic Stop Epilepsy as an easy way to remember what to educate our patients. The S is for sleep loss. T is for trauma, especially head injury. O is for overexertion. P for pregnancy. So basically anything that causes a hormonal shift in the body can trigger a seizure. E for electrolyte imbalance. We talked about the importance of having the proper amount of calcium, the proper amount of sodium in the body. So hypocalcemia, hyponatremia, and hypernatremia can have an effect in a patient and can cause a seizure. P is for therapeutic level. Is the patient compliant with their medications? Are they going to the lab to get their blood levels checked to make sure that they are therapeutic? This is very important because if the patient is under-medicated, they can have a seizure. I is for illness. L is for loud noises, and visual disturbances can trigger a seizure in a patient. E is for ETOH, which is alcohol abuse. This can lead to seizure activity, especially when the patient is drinking alcohol while taking anti-seizure medications, as this can have an effect on how the medication is metabolized. P is for period, as in menstrual cycle. Anything that has a role in hormonal changes in the body can trigger a seizure. S is for stress. And Y is for hypoglycemia and hypoxia. The brain needs sugar as well as oxygen in order to function. If the patient is hypoglycemic, where their blood sugar is low, as well as hypoxic, where their oxygen saturation is low, this can trigger a seizure. Now let's quickly review some common seizure medications. The first one is benzodiazepines, and the more common ones that you're going to see are lorazepam and clonazepam, which are used for absence, focal, or tonic-clonic seizures. Remember that benzodiazepines act on the inhibitory neurons in order to stimulate the release of the neurotransmitter GABA. Once the benzos are attached to these receptors, it makes the nerves of the brain less sensitive to stimulation that is being caused by too much glutamate that is being released by the excitatory neurons, and this has a calming effect. Benzodiazepines are used for status epilepticus. Remember, that's when the seizure lasts more than 5 minutes because it is fast acting. Some side effects of the benzos are that the patient's going to feel drowsy or confused, and an adverse effect can be liver impairment. So it's very important that you as a nurse are checking your patient's liver function labs. Also make sure to have the antidote flumazenil on hand in case the patient receives too much benzodiazepines, as this is the reversal agent for the medication. Another medication that is used for seizure patients are called barbiturates. The most common one is phenobarbital. It is used for focal, tonic-clonic seizures, and status epilepticus. Now, barbiturates are a group of drugs in the class known as sedative hypnotics. As a result, they have significant depressive cardiovascular and respiratory effects. So it is super important that as the nurse, you monitor your patient's blood pressure as well as respiratory status, because this can cause respiratory depression and hypotension. Although rare, phenobarbital has been associated with Stevens-Johnson syndrome, which is considered an emergency that results in blisters, specifically in the mucous membranes, fever, and widespread pain. A side effect of phenobarbital or barbiturates are drowsiness and ataxia. And regarding the antidote, there is no antidote for barbiturates. However, they have stated that activated charcoal may be used. And if that doesn't work, the patient may get hemodialysis. Another medication that is given for seizures is called phenytoin, which is part of the classification of hadontoins. It is used for focal and tonic-clonic seizures. This medication has a lot of things that you as a nurse have to monitor in your patient. First, bone marrow suppression. So you need to monitor your patient's white blood cell count and platelet counts as they can drop. Also, as a nurse, you need to assess your patient's gums and educate them on having good oral hygiene because this medication can cause gingival hyperplasia, which is that the gums become very enlarged and start to bleed. It is also very important to educate your patients on monitoring for any rash. They need to look at their skin and see if any rash develops because the same as phenobarbital that we discussed earlier, this medication can cause Stevens-Johnson syndrome. Another thing, please do not give this medication with milk or antacids, and it's very important that you educate your patient on this because milk and antacids can interfere with the absorption of the medication. The therapeutic level for phenytoin ranges between 10 to 20 micrograms per ml. If the level falls below 10, the patient is considered undermedicated and is at risk of having seizures. If the level goes above 20 micrograms per ml, that means that the patient is getting too much medication and it can be toxic for the patient. So it is important that the patient understands that they have to go for their scheduled blood draws in order for us to monitor the therapeutic level of the medication. There are other therapies that are used for patients that have seizures, for example, surgery, where they remove a part of the brain where the seizure originates from. For example, if the seizure comes from the occipital lobe, they will remove that lobe. If it's coming from the frontal lobe, they will remove the frontal lobe. Also, in children whose epilepsy is not being controlled by anti-seizure medications, they are placed on a ketogenic diet, which means that they are on high fats and low carbs. Well, I hope that you find this video of great use to you. Make sure you like this video, share with your family and friends, and don't forget to subscribe to this channel if you haven't already. In that comment box below, make sure you leave your feedback on any questions that you may have because I do look through them and I personally answer all of your questions. Also, don't forget, visit us at drregisterednurse.com where you will find quizzes that pertain to all of the content videos that I have uploaded in this channel, as well as one for the one that we discussed today. Okay, well, have a great rest of your day. Don't forget to press that bell for notifications. Bye.